The dilemma is hospitals say without facility fees, they can't stay in business. But many patients say facility fees are so high, they can't afford the medical care anyway. 4-year-old Marka Zelinska has a serious heart condition that one day might require surgery.
We need to monitor his heart condition all the time, 1 to 2 times a year, just to see where he is.
Mom, Natalie Zelinska, used to take her son to Denver Health twice a year for an electrocardiogram and ultrasound. The facility fee, not the doctor bills, but the facility fee for hospital equipment and services was $55. But then the doctor moved to Florida and recommended Marcos go to Children's Hospital for his next visit. For the same service, her facility fee, even after insurance, went from $55 at Denver Health to $1,525 at Children's Hospital, Colorado.
If I knew that will be so expensive, I would just buy the ticket to Florida and we'll see our previous doctor.
When you went in for this appointment with your son, did anybody warn you that you could face a bill this high?
No, nobody warns me.
Which is why, before I interviewed Natalie, she had a question for me, when I've never been asked in 2 decades of reporting. You've been so burned by this high facility fee that you wondered if I was going to charge you for this interview.
Yes. Now I ask that question all the time before I get service.
Her experience is like so many, highlighted by the problem solvers last year, beginning with the Greenwood Village father whose son's therapy session came with an extra $500 facility fee.
This was literally just a lamp and a couch.
Brittany Tesso in Aurora received an $847 facility fee for her son's telehealth visit on Zoom.
And I was like, facility fee? You know, I didn't go to your facility.
Or how about Colorado Springs dad Ben Lose, who received a facility fee bill of $2,518 for his son's brain scan.
If you can get away with it and you can make more money, it seems like that's what the hospital's going to do.
I don't think the bills have skyrocketed. Do I think they've gone up in the last year? Probably.
Julie Lonborg is the vice president of communications for the Colorado Hospital Association. She says facility fees pay for everything but the doctor. For example, nurses, surgical techs, janitors, expensive equipment, utility bills, and on and on. But facility fees are not just charged at hospitals. Increasingly, patients face them at any doctor's office or out-of-patient clinic. How do you feel about facility fees?
I think they're horrible.
Dr. John McLaughlin followed in his father's footsteps and for 30 years has run a family medical practice in Aurora. He pays for his nurses and equipment out of his provider fee without charging his patients a separate facility fee.
If you're a hospital system and you own that practice, you can add a $200 or $300 fee that's just literally for breathing the air. They didn't do anything different than I do.
According to the Journal of Health Economics, 70% of doctor practices have been bought up by hospitals or private equity firms. And as they did, facility fees were added, and patients paid more for essentially the same service. Do you think facility fees have often been a way for hospitals to pad their bottom line?
Well, sure, of course.
As you might guess, a lot of patients and patient consumer groups believe that hospitals are padding their bottom line with facility fees. Is that a fair criticism?
No, not at all. Again, those fees are scaled based on the care that's provided.
The new measure being considered by Colorado lawmakers would, for the first time, limit facility fees. Facility fees would no longer apply to telehealth visits. No more facility fees for preventative care, no more facility fees for primary care visits. Plus, an independent report to study facility fees, when and where they're really needed, and how hospitals use them to meet their bottom line. Plus, transparency. Facility fees would have to be advertised up front at the time of service.
People should know up front. If we go to the supermarket, we see that bread costs $2 or $10 or $50, and we buy it or not buy it, right?
So hospitals and the practices that work with us are committed to transparency.
But Lonborg says limits on facility fees could force hospitals to close clinics and reduce patient access to medical services.
This has the potential to have devastating, catastrophic consequences to the patient care system in Colorado.
Dr. McLaughlin tells the problem solvers it's rising facility fees that are having catastrophic consequences for patients. How important do you think it is for Colorado to pass this measure that would limit facility fees?
I think it's incredibly important to do it now. The longer that outpatient facilities fees become accepted and part of the practice, the less likely we'll ever go back. This will just be another cost to the working class that they just have to take.
Your son may need another electrocardiogram in July.
Yes.
Will you go back to Children's?
No.
Children's Hospital provided the problem solvers a statement that you can read on our website, kwr.com. The measure has its first hearing tomorrow morning. Expect the hospital lobby to do everything it can to water it down significantly. And they've already had some success. Just removed from the bill was a ban on facility fees for off-site clinics. That's any hospital facility that's more than 250 yards from the main hospital campus. That is no longer part of the bill, and that's a huge win for hospitals. Rob Lowe, Fox 31.